We know for many years that one of the biggest problems with partial knee replacements was that it's very difficult to get that alignment perfect, and if you don't get it perfect, they're very, very sensitive to malalignment, and it leads to a lot of the early failures. Having this type of precise technology available with the simplicity we've already seen from the total knee application is really going to be game-changing when it comes to allowing us to predictably and successfully do unicompartmental knees as well.
So UniAlign is a really unique product. First of all, I call it the audible. It's great that sometimes you have a patient where you think they might be a candidate for a partial knee, but sometimes they end up being a candidate for a total knee. And to be able to go through a system where you can go seamlessly from partial knee to total knee, still affording computer-assisted surgery and all the benefits of that, without having to be boxed in by your preoperative implant decision-making process. For example, a lot of current systems decide on a partial knee or a total knee preoperatively, and the technology you use in the OR is based on that plan. Sometimes what you see in the OR isn't always what you decide preoperatively. It's great to have that power in the OR without disrupting flow at all. The whole premise for alignment is based on the tibial cut. So if your tibial cut is off, the rest of the knee is going to be off. The advantage of UniAlign is you're always getting your tibial cut correct. You're basing on firm bony landmarks individualized to each patient. So you know your varus angle is correct, and you can dial in the appropriate slope based on the implant choice you're using, again being open platform. Once that cut is accurately cut, everything keys off it, and you always get a perfect result.